Hello, good evening and welcome to News 360, our major news bulletin for the day. Ghana Health Service says the change in the global situation, particularly with reported increase in new cases in China and other countries, as well as Ghana's relatively low vaccine coverage, poses a major threat. Let's explore this matter further. Dr. Banda Khalifa is a public health physician, PhD student at university in the USA, and also a vaccine regulatory and policy analyst at the International Vaccine Access Center. Thank you very much, sir, for your time, and good to have you on News 360. There are reports of thousands of cases with several deaths in China. Some videos have shown hospitals overflown with patients and crematoriums. What exactly is happening in China?
I think the situation in China is quite different. Each country is unique. But as you may be aware, during the inception of the COVID-19 pandemic, China had a policy in place that was called the zero COVID policy. So the zero COVID policy was to make sure that if any case is detected in any particular city or suburb, authorities immediately go in, quarantine the whole place, test until the case is no more detected. Fast forward to December, this zero COVID policy was lifted. A lot of cases were recorded because the variant that is currently circulating in China, which is the BF7, is highly transmissible compared to the original variant. And it is also interesting to note that in China, even though their vaccination coverage rate is a bit high, most of the elderly, about 30% of those who are age 60 and above, and about 60% of those who are 80 and above are unvaccinated or under-vaccinated. So couple these factors, the lifting of the zero COVID policy resulted in a higher number of cases that has overwhelmed the health system. That is why we are recording such an enormous number of cases from China.
The Ghana Health Service today released a statement about COVID-19. What should Ghana be doing differently?
Yeah, so I think that Ghana releasing a statement now is very, very crucial and it's very important. Scientific communication is the way to go. Several countries have instituted measures, including the US and other European countries, on tests on arrival for flights coming from China. However, I think that Ghana is not in a position to, require those mandatory, because the variant that is in China is not currently causing any havoc in any other country because of the peculiarity of the situation in China. So I think that Ghana can continue to monitor the situation as it unfolds and then encourage their citizens to go and get vaccinated, because the vaccines have been shown to still be effective against the variant causing havoc in China. So the mainstay should be public education and then continuous monitoring of the situation globally.
At the beginning of the COVID pandemic, there was a lot of talk about herd immunity. Shouldn't we be rest assured that we've achieved that state of herd immunity?
Yeah, so I think that herd immunity is an interesting concept. Okay, for COVID-19 specifically, it is very difficult to achieve herd immunity because of several factors. Now, biologically, it's not feasible because, as we are all aware, the vaccine is not 100% effective. Those who get vaccinated get reinfected. So it will be very difficult to meet the critical vaccination threshold or the number of people or the percentage number of people who need to be vaccinated in order to protect others from getting infection. Another reason too is that the rate of mutation of the virus is much higher than the rate at which you are able to vaccinate people. So make it very, very difficult to make up for the mutation rate. And technically too, it's not feasible because we have a lot of hesitancy issues. There are a lot of unvaccinated folks walking around, and we don't have the resources to vaccinate to the level that we need to get in order to achieve herd immunity.
Dr. Banda Khalifa, I've got to say a big thank you to you. Dr. Banda Khalifa is a public health physician and also a PhD student at Johns Hopkins University in the United States of America. He's also a vaccine regulatory and policy analyst at the International Vaccine Access Center, helping us do some more analysis on this developing story of